So this is my drawing of the hearing system. I have the outer ear, the middle ear, and the inner ear labeled here. And so the outer ear consists of two different parts, the external auditory meatus and the pinna. The pinna has a bunch of different landmarks, such as the lobe, the helix, the tragus, and it's shaped specifically to kind of capture sound waves, and it is what we pretty much think of when we think of the ear. And then the external auditory meatus consists of a cartilaginous portion, skin, hair follicles, and glands which secrete cerumen, also known as earwax. The cerumen helps both protect the ear from like external objects getting in, and as well as like bugs, and it also helps lubricate the ear, which allows better transfer of sound. And then we have the tympanic membrane, which is the border between the outer and the middle ear. The tympanic membrane is a concave shape thing inside your ear, which consists of 4 different layers. We have the epithelial lining of the tympanic membrane, which is the first layer, and then we have 2 fibrous layers in the middle, and then we have the lining of the middle ear on the inside. And so this essentially just vibrates, and as the air pressure hits it, which it's tightly connected to the ossicles, specifically the malleus, and as the tympanic membrane vibrates, it causes the ossicles to vibrate as one. The ossicles are made up of 4 different ligaments: the lateral ligament of the malleus, the superior ligament of the malleus, the anterior ligament of the malleus, and the posterior ligament of the incus. And these all kind of hold it in place. And so the tympanic membrane, as it vibrates, it causes the ossicles to vibrate and eventually causes the stapes to move in and out of the oval window, which I don't have depicted because it was difficult to draw. But so the stapes moves in and out of the oval window, which connects to the cochlea and causes transfer of sound energy. But before I get to that, there are 2 purposes to the ossicles. One is to transmit the sound from mechanical energy to the chemical energy that will send signals to our brain about what we're hearing. But the other purpose is for protection. We have 2 muscles, the tensor tympani muscle, which is connected to the malleus by a ligament or a tendon. And when it contracts, it tightens the malleus and prevents it from vibrating as much. And then we have the stapedius muscle, which does the same thing, except it connects to the stapes and prevents it from vibrating as much. And essentially what this does is that around 80 to 90 decibels, after being exposed to that sound for 10 milliseconds or so, these muscles activate to stop the ossicles from vibrating as much, and therefore stop the cochlea from receiving as loud of a signal. And this just softens the sound that we hear. Also, we have the eustachian tube, which I have drawn right here. It moves downward, forward, and laterally into the nasopharynx. And the eustachian tube has a couple of different purposes. It drains mucus, for one thing, and for another, it kind of creates an equilibrium between the air pressure in the middle ear and the air pressure around it. And so the tensor veli palatini is a muscle that is within the nasopharynx. It's a velar muscle, and essentially the side of the tube that is in the nasopharynx is always contracted until the tensor veli palatini relaxes and allows this equilibrium to happen. And this could help with sound quality, though this doesn't directly relate to hearing. And so that's the middle ear. And then the inner ear consists of the vestibular system and the cochlea. The vestibular system is housed within these semicircular canals, and the hearing mechanisms of this is within the cochlea. And so the semicircular canals are on 3 different planes. Again, that was kind of hard to draw, but it creates this 3D type of system within our inner ear. And so when we turn our heads, it can tell exactly which plane of this 3D system that we are turned to because of these semicircular canals, which contain fluid. And a part of the cochlea, I forgot to say this, a part of the cochlea is there is the bony labyrinth, and there is well, I forgot. The membranous labyrinth, which is inside the bony labyrinth. The bony labyrinth is indentations within the temporal bone that protect the cochlea, and the membranous labyrinth is the second layer of that. And the cochlea has 3 different parts within itself. It has the scala tympani, the scala vestibuli, and the scala media. So perilymph is found in scala tympani and the scala vestibuli, and then endolymph is found in the scala media. And so when the stapes moves in and out of that oval window into the cochlea, it causes the fluid within the cochlea, specifically the perilymph, to move, which in turn ends up squeezing. There's, within these tubes, within the scala media, there is a basilar membrane and a vestibular membrane, and this movement of fluid within the cochlea causes these membranes to come together around the scala media, which affects the cilia inside the scala media. And these cilia have attachments to the auditory nerve, or the 8th nerve, which I've drawn right here, and that sends the chemical message to your brain that you're hearing something. And I believe that's everything.